Good evening, Australia. I hope you're there with your glass of wine, a good glass of wine. I know you have really good wine in Australia. So, as Frank said, I'm really excited to share with you a fantastic line of products, in addition to our Nimue brand. Frank gave me a great introduction there. I've got to admit, when you say how many years of experience I have, makes me feel quite old. But yes, I've been in the industry now for many, many years and have been fortunate enough to work with Nimue now for 10 years. I'm based in the UK. I'd like to say sunny South Wales, but at the moment it's a bit overcast. But I know the sun will shine this afternoon as we're heading into summer. Fingers crossed, we're in spring at the moment, heading into summer. So firstly, as you can see, the look of these products is definitely got more of that medical look to it. And that was our intention. We know as a brand that we are really good at supporting the skin. We don't want to all of a sudden come up with Botox and fillers and, compete in already a very saturated market. What we wanted to do was to support this market, which is growing so quickly. And like I said, going back to what we are proud of, what we firmly believe in. Frank mentioned then about barrier. This has always been our expertise. We kind of evolved Nimue over supporting pre and post-operative procedures. And that's almost where we've gone. We've gone a little bit back to our roots with our MD. Now, I'm going to just give you an overview this evening. It's not going to be an actual class. Of course, you've got the fantastic team there at Vital Plus who will be there to answer questions, there to give you the in-depth information. So let's get straight in to our MD range. First of all, what is the aim of the complete range? Well, these are topical products. Some of them can be used post-treatment. Some of them are just retail only products, and I'll talk you through which ones, fit in where. You'll see the sizes here do vary as well. So you can see here. Now, this would be the one that you would use in your professional setting. So it's not like normal Nimue as in the big bottles, because of course you don't need to use as much product for specific areas. Now, if we take a look at the line of products, all of them have, well, you could say 4 key things in common. That is, they are all working on our inflammatory response. So they're all controlling inflammation, which is, of course, reducing downtime. When you can reduce inflammation and speed up somebody's healing process, they're naturally going to have a better results with downtime post-procedure. The other aspect of the whole line is that it works on accelerating your skin's natural wound healing. And we'll touch on that as well this evening. And of course, I always say it's a win-win, because when you're offering a treatment in your business, whether that treatment is microneedling, whether that treatment is radio frequency, whether you offer injectables, this is just purely going to enhance your results. If perhaps you don't do any of those and you maybe only do peels, that's absolutely fine. We've got 2 amazing retail products, which I'm going to highlight at the end as well of this evening, which will fit into anybody's routine. So let's take a look at a few of our sort of concepts behind the range. Well, as I mentioned to you, the main focal point is to aid the healing process, aid the inflammatory aspect. So if you're thinking, does this particular product work for my client? Is this product going to be indicated for my client? I would almost say this would be like a checklist. So do you see a damaged barrier? Yes, then you can definitely use the products. Do you see inflammation? Is there any edema or swelling or pruritus, which is itchiness, redness, erythema, going right through to, is there any burns, whether that's 1st degree, 2nd, 3rd, Or are you offering something where you need reepithelialization, post-peel, remodeling of the skin with microneedling, nano-needling, whatever device you're using, radio frequency? And then last but not least, is there any scar tissue? Tissue that maybe is fresh, is new within the first year, that you can hopefully speed up that healing process as well. So this, I think, is good, like I say, to almost do like a tick box if you're seeing these issues on your client's skin. Now, a big part of the MD range is that it works on our wound healing process, which is a natural process that happens. Even if you did a simple thing like gardening and you were, trimming your roses within your garden, and you accidentally cut yourself on a thorn, your response is going to go through what we call 4 phases. Now, when you do any type of inflammation to the skin, whether that's needling, whether that's another type of treatment that is causing collagen to be produced, you're also going to go through this particular wound healing. And this is where the specific products are going to work. So if we have a look at the first phase is called homeostasis. So that is, oh my gosh, I've got blood on my finger, as you can see from the image here. I've, caught my finger on a thorn, or I've cut myself. What is happening here is obviously you've got red blood cells flushing to the area, you've got white blood cells flushing to the area, and your skin immediately goes into phase 2, which is inflammation. So that can be straight away, right up to 3 days. As a form of inflammation, what do you typically see? Pain, swelling, so redness, swelling. You might even see some kind of a blister or pus starting to appear. And that will also show you that your skin is going through ready for the final or the later stages, which is phase 3 and phase 4. So this is just to give you an approximate, because obviously it depends on what type of wound it is. And also what, how old is the client? What's the age of the client to how quickly this will happen? So phase 3 is called proliferation. So basically what that means is your dead skin cells, all of your skin cells, your collagen is coming up to the surface to knit that wound back together so that you can heal. You've given, quite a wide range of days there, 3 to 24. Again, because it's very age related. If I look at my son, unfortunately, he fell yesterday, as boys do, fell off a wall, cut all the back of his leg. Guaranteed in 3 days, his skin will heal. If it was me, no. It's going to take me a lot longer because obviously I'm a lot older. So it's going to take a while for my skin cells to come to the surface, for my collagen to remodel. The last stage, which is stage 4, is that remodeling. So when anybody does any type of collagen induction therapy, that remodeling goes on and on and on. The inflammatory stage is first. The proliferation stage is a few days after the treatment, and you might see some dead skin cells starting to flake off. It's the remodeling that happens then over time. So that's why in a week, 2 weeks, you go, oh, my skin looks amazing. And that's the reason why. So when we are thinking of our MD products, we are putting them in these specific phases because we really want to ensure that we are treating that particular phase with amazing ingredients. So just to give you an overview, the products that you would use post-procedure, post-treatment, so they're your professional products. And I'll talk through them in a moment, which is an anti-inflammatory serum, a post-procedure balm, a ND cooling gel, and a microgel. They're going to work on that first 2 phases. So your inflammatory phase and your reepithelialization phase. Hence why they're in your procedure. You need to get them on the skin straight away so that they can start to work on those 2 phases straight away. What things would you see? Bruising, trauma, inflammation, and that's really where these products are going to work. Your retail products, which is what you're going to be selling, are going to work on the last two phases, proliferation and remodeling. So they are things like the serum again, the balm, the cooling gel. Then you've got extra things which are retail only, like the rescue cream, the power serum EGF, your epidermal growth factor serum, your brightening serum, and then something like your scar gel as well. So with that in mind, let's take a look at what I call hero ingredients, because they kind of sit with a lot of products. And to me, they are the power really behind the brand of MD itself. The first one is horse chestnut. So this might be familiar to you. You might see this. We see it in our autumn months here, falling off the trees, our conkers. And this ingredient is fantastic at not only stimulating circulation, so you tend to see this in a lot of cellulite creams for that reason, but it reinforces your immune system and it works on inflammation straight away. So this you will find in our anti-inflammatory serum that you would put on straight away. The scar gel, that again, if you have a scar tissue, you would apply that straight away and in the days coming. And our cooling gel. When you see the product, and let me just grab one here, and it has a brown color like this, that will tell you horse chestnuts in it. So that's the best indication to know if that ingredient is in the product or not. The next one that we have, you might know this for foods. It's fantastic ingredient for curries. It's a fantastic anti-inflammatory ingredient. I'm sure in Australia they have it in shots, little shots that you can take with ginger, which is really good for your immune system. It does exactly the same thing for your skin. It is from the turmeric plant, as you can see, and it is a callus lysate. So it's a plant stem cell that we're using here. Now, what this actually works on is it works on neutralizing stress inflammation. So that brain kind of skin connection where you feel pain, discomfort, and it works on those kind of messages back and forth. It also immediately helps with the wound healing aspect. So it stimulates the healing. It protects against collagen and elastin degradation. And it also aids with hydration and calms post-treatment. So again, you see similar products, the anti-inflammatory serum, the scar gel, and the Microglide gel. Here you can see again some more information when I said it works on that kind of brain skin connection. It's also known as the emotional well-being manager because it works on that kind of, you could almost say, desensitization in the fact that it soothes instantly. So when you feel that pain, that discomfort post-procedure, it's going to almost calm and soothe by working on this brain skin connection. The next plant that we have is a natural alternative to hyaluronic acid. And this comes from our tamarind plant, and it's a natural polysaccharide. It is great for improving elasticity in the skin and moisturization. So again, you'll find it in specific products like our scar gel where you need that moisturization, you need the slip and glide, the cooling gel, the brightening serum, and our anti-inflammatory serum. This one, if you know Nimue and sensitive skin products, we launched this ingredient in there. We loved it so much for its results that we've brought it into MD. And that is your glycerinitinic acid, which comes from licorice root that you see in the visual here. Fantastic at working on instant itch, pain, and redness. It is working on inflammatory mediators. It's quite a complex ingredient, but almost think of this as reducing that pain, that discomfort, that inflammatory mediators, really, that pro-inflammatory mediators that immediately get released when there is being kind of trauma to the skin. So again, 3 products there you'll see that you'll find this ingredient in. We love this. This is actually still trending globally as a hot ingredient. Your nicotinamide, your niacinamide. This really works on post-inflammatory hyperpigmentation. So that's why you will find it in our Rescue Replenishing Cream for eczema, so that they don't, leave pigmented. Of course, our Brightening Serum, which works on pigmentation. And again, our Scar Gel, because we want that, to heal with hopefully no hyperpigmentation. So this works not only on treating post-inflammatory hyperpigmentation, but it also aids the DNA repair. So again, if there's been inflammation, trauma, it's aiding the skin to heal and improves skin elasticity. So let's give you an idea of the products. The first one I'm going to talk to you about is our post-procedure recovery balm. As the name says, it's a balm. It's rich in consistency. The texture, I would almost say, feels a little bit like a petroleum, but it's petroleum free. So that's a big selling point. But this is a healing coat for your skin. You put it over your skin, let the skin do its job, let it heal itself. That's what the skin is supposed to do. It's a short-term product only, because once your skin has started to heal, your skin's natural cells, inflammatory mediators, collagen, elastin, hyaluronic acid, they play such a huge part. An overview of ingredients is here, but you've got things like avocado oil, cannabis sativa oils, isosteryl isosterate. So it's a rich consistency in a professional and a retail product. I'll give you an idea of when you would use this. My husband had a really nasty trauma here to his eye, where he had to have it glued together in hospital. So immediately I got him to put the balm on to aid the skin to heal. He used the balm for 3 to 5 days, and then he went on to the Scar Gel. As soon as the skin was knitted together, then the Scar Gel can take over. So if we have a look here, this is an example of where we've used the post-procedure recovery balm. So this was after a TCA treatment. And as you know, with TCA, the skin sheds, peels. And we recommended this client to be using this topically all the time as almost like a moisturizing barrier treatment. Post-procedure, continuing then for days, and you can see the after 6 days. The skin doesn't look red, the skin's barrier looks healthy, and you almost wouldn't even have known that she's had such a strong peel on her skin 6 days before. The next one that we have is our cooling gel. Our cooling gel has that horse chestnut, aloe vera, it has that tamarind plant, but the main ingredient is a cooling agent. So when there is any heat in the skin, this instantly cools. So fantastic for bruising, swelling. If a client has had any injectables that has caused bruising, Botox fillers, anything like that, immediately works. We've also seen some fantastic results with our liposuction. It's a treatment that can be used post-procedure, and then you will continue to use for home care. So an example would be you've had Botox, you've got a little bit of bruising in the areas where you've had the Botox, you can apply straight away in clinic, and then the client can take the smaller, you can see home care product home and apply about 2 pumps, just depends obviously on the area that they see in the bruising. This is our wow. To me, this is our before and after. So this is 7 days post liposuction. Of course, support stockings, all the usuals have been given here, but it's the bruising. Look at the bruising has gone, has completely vanished. And I've got 100 more before and afters that we have to support all of our products for you to see. The next one that I think would be one that you would definitely benefit from in your treatment room and also to offer to your client is our anti-inflammatory serum. You can see this little serum is small but mighty, packed full of ingredients to treat inflammation. So any procedure that you have done, any treatment that you have done where there's a lot of inflammation, you would apply this directly after your treatment. It is then a home care product that your clients would put underneath their moisturizer, if they can tolerate it, every single day. So you've got things like that turmeric plant, stem cells, horse chestnut, you've got the tamarind plant, you've got your vitamin B5, and you've got other ingredients to increase, you can say, the hydration. So to give you an idea of what treatments you would use this, it can be used with invasive and non-invasive treatments. So if you did things like laser, CO2 laser, IPL, radio frequency, this is when you would use this serum. Basically think inflammation, this would be your indicator to use. If you're doing threads, needling, anything like that, again, this is your perfect serum for you to use post-treatment and for your client to use as home care. Amounts just depends. It really just depends on what you're treating. We've given you just approximate here. And again, Danny and the team can go into further details how to use the products and some key specifics. This is an example when we've used it in our in-house lab that we've got in South Africa. So this client was having a course of microneedling pen treatments, and we did this post-procedure, and we also asked her to include it into her routine every evening underneath the moisturizer as a serum to really repair and heal the skin as quickly as possible and reduce inflammation. Our next wow product, and I say wow because honestly on scars this is absolutely amazing. I've seen many scar gels appear on my time, but I think this one really is the proof is in the pudding, they say, when you see the before and afters, and if you've ever used it yourself. So we have a whole array of ingredients. This has got tons of ingredients in there. We have epidermal growth factors. We have peptide complex. We have that glycerinitinic. We have cannabis sativa, horse chestnuts, so many ingredients to really repair and knit that skin back together as quickly as possible. Can you use it on existing scars? Absolutely, within 1 year. As you know, post sort of 1 year, there's not an awful lot you can do. The fresher the scar, the better. If there are still stitches in, sutures in, I wouldn't use it. They need to be out. If you've got a micro tape over the scar still, this can sit on top of a micro tape. It will absorb in and you can continue to use it. My guidance on this product is reapplication is key. That's when you're going to see the best results. It's not a case of, oh, let me put it on my scar and then do it the following day. Keep reapplying 3, 4, 5 times a day so that you can get those ingredients on the skin so they can really aid your skin to produce more cells and to heal itself. So an idea of when to use your scar gel, you could use it not only on scars and cuts, like you see with the picture here, if you have any traumas to the skin like this, but it can also be used, and we've seen some fantastic results on post-acne scarring. Really good. If you're doing a microneedling treatment for acne scars, or you're doing any other type of procedure to eliminate the scars, then this could be your scar gel for at home. Scar prevention. Again, any wound where you know there's going to possibly be a scar, then this is where you would apply this particular product. Tattoo removal. Again, if there is a risk of there being possible scarring, then just recommend this gel to be used every single day. Any damage, any traumatized skin. You don't need a lot. You need a small amount. This is a guideline. You can see 1 pump for a 10 centimeter scar. So you really need a small amount if it's just a little bit. There is a precaution with this. You can see highlighted here in red. Do not use on eczema, psoriasis or skin cancer due to the fact it's building up skin cells. That's the last thing you want with psoriasis. That's the last thing you want with eczema. And of course, we have to be careful with skin cancer with the various ingredients that we have within this product. This to me, and you know, I'm so grateful that we work with a South African company where we've got skins of all different colors to trial and to test, is a wow, because treating a skin with a dark phototype like this is extremely hard with scarring, because naturally you're going to get something like keloid, because that's the nature of, you know, that particular phototype, and you're going to be left with hyper or hypopigmentation. But just look at that before, look how deep the scarring is there. So they've had microneedling to help. Look at the after, you can hardly see it. The fact that, you know, the pigmentation is not there is also a big wow factor, thanks to the niacinamide that is sat in there. So this really is an amazing scar gel. Here again, look at this lady, a deep scar, I think quite a pitted scar. Here, you can hardly see it. Nothing else was done, just microneedling with the scar gel post and to be used at home care. So this was 16 weeks after. And again, so many more before and afters we've got with these products. Our next product is a retail only product. This is for your severely dry skins. Now, I don't know in Australia if you tend to get a lot of people with atopic dermatitis and eczema. We typically do in Europe. And, you know, is something that can be genetic, but this treats any form of atopic dermatitis, whether it's perioral dermatitis, whether it's just your eczema in areas. This is your rescue replenishing cream for eczema. It's not really a treatment for psoriasis. I'm a psoriasis sufferer, so trust me, I've tried it. Psoriasis is completely different. So this works on barrier, on moisturization, on comfort for the skin, because unfortunately it's the itch scratch which can cause the damage with clients with eczema. So dry, very dry, cracked skin, and this is your retail only product. So you could use it in areas, just eyebrows, neck, ears, wrists, joints, or of course if you've got a larger area like forearms, legs, you could also apply it on there. This again, rough guidelines, 2 pumps, depends typically on the area. Here you can see this poor lady here, again, a darker phototype, so a harder to treat because she's got the high risk of the skin healing and becoming pigmented. You can see it's just taken away that pain, that cracking, that redness, and that's just 4 weeks. So it's not a cure, but it's a soothing. You can say it's a nice, nourishing treatment to help with those flare-ups. So before we go into our next products, I wanted to just talk to you about combinations. So when I've launched MD in several countries, this has been a lot of the questions that I get asked is, can you use products together? And how would you use products together? Well, these products here are products that kind of sit really nicely together because of what they're working on. The first one that we have is our treatment here of scarring. So if you were doing a treatment to treat acne scars, it could be, as you could see, the laser treatment, it could be microneedling, it could be radio frequency. When you've done that treatment, you can offer the client the anti-inflammatory serum if she's very red. You could maybe just use this post-treatment in your treatment room. You've done the procedure, you apply the serum on the skin. They then need to go home with the scar gel. That's the key. That is going to prevent scarring and treat existing scarring. The next combination you can see, and sorry for the graphic image below, this is when you would use the balm and the scar gel combination. So this is when my husband used these 2 products as well. So you can see this lady has had an operation. She's got some scar in there. She's got some stitches in. You can see the redness where the stitches are. that's when the balm would be applied. We would not apply scar gel because the stitches are still in the skin. The balm will reduce the redness. It will aid the healing of the skin. 3 to 5 days. Once those stitches have been removed, swap onto your scar gel all the time. I mean, just look at this image. You know, it's an older lady, so a lot longer healing, but fantastic results there with the combination of the balm and scar gel. Then we have our Microglide gel. Now, in all my years of working for Nimue, we have been requested this product for a long, long time. Somebody has wanted, you know, some kind of medium to use with a pen, with a roller, to enhance their microneedling. Yes, we have our fantastic superfluids, but if you know from superfluids, they absorb into the skin. They don't give you the medium as a glide as such. This is now your Microglide gel. It's the medium for you to use. You've got in there the 2 types of hyaluronic acid, and you've also got plant stem cells to aid the healing and inflammation. Here you can see can be used with any type of microneedling device, pen, roller, stamp, whatever you're using, whether you're using combined with radio frequency. This is when you can use this for your slip and glide as a medium basically to be used. Then we have, last but not least, aging. Now, aging is the #1 concern globally. It is the #1 concern when it comes to ingredient formulation, and it is the #1 concern of clients whether they go into a salon or whether they go into an aesthetic clinic. So I've just given you some examples here of what's offered. So they could go into your clinic and you might be offering a microneedling treatment. Maybe you're doing plasma therapy. Perhaps you're doing radio frequency as a solution. Then we've got a home care product for them to walk out with. Maybe they're going into more of a medical setting where it's deeper microneedling, threads, injectables, different types of acids to treat and, you know, aging and enhance collagen induction. We have got the home care product to support this. So this, oh my gosh, ladies, is a big, and gents, wow. It is your Epidermal Growth Factor Power Serum. It is jam-packed full of those amazing ingredients to treat and reverse aging. So that's why it works perfectly with those kinds of treatments. Not only does it have a growth factor in there, it also has a peptide called tripeptide 3, which is plant derived. So, a bimetic derived, not plant derived. And it works on various types of collagen, fibronectin, as well as supporting the growth factor that you will get to stimulate your collagen. On top of that, you've got vitamin C. As you know, you need vitamin C to stimulate collagen. So this is a really powerful product with anti-inflammatories in it to support the aging process. So who would you recommend this on a client or to be used? Anybody who's concerned with aging. Anybody who's got lines, wrinkles, loss of elasticity, sun damage, like I said, having treatments with you and they want a home care product, you could do a combination where, you know, you upsell a course of treatments with this particular product. So just to go over those ingredients in a little bit more detail, the epidermal growth factor that we use is from a non-animal source, which is a big thing. It's from oligopeptide. And how growth factors work is they enhance your skin's epidermal growth of cells to the surface, but they also stimulate collagen and hyaluron, so hyaluronic acid. All in all, aiding lines, wrinkles, healing, hydration. Your natural polysaccharide that's in there aids inflammatory mediators and also overall hydration, which helps with skin remodeling. You can see it is a home care product only. So here it is a 30 ml, and we've given you some approximate guidelines with the amount of pump. So I've just put one pump on here, and you can see one pump goes a long way. So 6 pumps we've said for face, neck and décolleté, but if you just wanted to use a little bit on spot areas, you absolutely could. Now, it does sit underneath your moisturizer as a serum. So you would layer this, so cleanse, condition, exfoliate. I wouldn't use a booster because this is more than your boosters in one. This would replace your booster as your serum morning and evening, following a moisturizer and SPF. So if you wanted to treat the whole area, face, neck, décolleté, then you're roughly going to use 6 pumps. Here is where we have used it in combination with treatments as well. So this client just used the growth factor serum on its own to treat lines and wrinkles. So you can see 17 weeks, how that's really decreased the depth of the wrinkle and also brightened the skin because you've got the vitamin C in there. It's also going to work at brightening the skin, but you can really see here these lines and under the eye and how it's really helped with that sun damage there on the forehead. So some selling points that I also wanted to reiterate, because there's many serums out there now that say they've got growth factors in them. They range from, I could give you an example of £20 I could buy on Amazon right through to £200. So, you know, what do you get for your money? Well, I'm sure you can imagine your £20 one is not going to give you anything that a £100 serum would do. Sorry, I'm not very good with Australian dollars. So just to give you an idea of the variance of prices. But of course, it is a higher price product. Epidermal growth factors as a raw material are expensive to buy. So, you know, if you've got a really good quality epidermal growth factor, it's going to be a higher price product. Now, the difference between ours and others that are available on the market, the first thing is our growth factor is not sourced from China, and that's a big thing. We have done a lot of ethical, clinical testing, raw material testing of our growth factor, and the biggest selling point is that it's stable. It's high in concentration and the stability is there, meaning that when you go out into the environment, it is not going to degrade because that is also of high risk. The other big selling points is the combination. You've got other ingredients in here, so you've got maximum efficacy, a stable form of vitamin C, all of those remodeling ingredients, anti-inflammatory, peptides, jam-packed full in this one little serum. And of course, the biggest thing is can be used on any type of skin, any type of phototype as well. Then last but not least, with our next retail product is our Expert Brightening Serum. So same size, 30 ml. And if I just pump a little bit here, a little bit more of a richer consistency. But again, it's that serum type of scenario or serum consistency. What is the big wow ingredients behind this one? Tranexamic acid, which is the go-to for pigmentation, along with niacinamide, a peptide complex, and of course your vitamin C. So it really is jam-packed full of ingredients to treat pigmentation. It is the latest, it is the best treatment for pigmentation. Far more superior to our faders, far more superior to anything, to be honest, that we've got within Nimue at the moment. How would you use it? You would use it as your home care product to support pigmentation, to support procedures that you've used, like microneedling, peels, to treat all types of pigmentation, all types of skin classifications and phototypes. Here you can see we recommend face, hands for age spots, scalp for men. Don't forget they can also get pigmentation there. And of course, the chest, I know, is a big area, particularly I'm guessing in Australia with the, you know, your high levels of sun and UV index there with damage. So approximately 6 pumps again, underneath your moisturizer. Don't forget your SPF, absolutely essential for every day. Tranexamic acid, I'm sure you've all heard about it, so I don't need to go into too much detail about it. Why is it so good? It is so good because it is a plasmin inhibitor. So I've just put up a comparison here because on the market, you've got tyrosinase inhibitors, which we've used before, and they can be anything like kojic acid, hydroquinone, azelaic acid, but plasma inhibitors is only tranexamic acid or esters. So they are working on a higher level of activation of melanocytes. And again, Danny and the team can go into this in a lot more detail if you have questions on this. On top of that, a peptide, which is going to brighten the skin, is going to work on that tyrosinase. So you've got that extra tyrosinase inhibitor. And of course, vitamin C that works as a double block. It works on brightening and it also works on inhibition of melanin within the skin. Coupled with niacinamide to treat post-inflammatory pigmentation, isosterol isosterate for hydration, and that natural hyaluronic acid. So this is another wow product that you will see. Again, the before and afters will be your wow. You will be amazed at how it treats even that darker phototype, which is the most difficult to treat with pigmentation. So some key selling points. The type of tranexamic acid that we're using, which you can see here is called cetyl tranexamate mesylate, which is far superior. The combination of all of those ingredients that I just shared with you, the fact that we have a peptide that is in a smart capsule, a highly effective oil-soluble vitamin C, and we've added in there your niacinamide or nicotinamide to aid with post-inflammatory hyperpigmentation. So let me share with you one of our before and afters. I've got two. I've got another lady, it's not in the PowerPoint here, but it's a really big one with a darker phototype. Again, difficult to treat, but see here, 6 weeks. Look at that. It's just, to me, it's just wow. Here you can see those real dark pigmented patches completely gone. Forehead, this patch completely gone. Not only is it completely gone, but you can see there's no whitening because, of course, it's not a bleaching agent. So it's just gone into a natural skin with the darker phototype as well. So that is our overview of our 8 fantastic products. Like I said, I didn't want to go too technical for you. I wanted to just launch this to give you a good understanding of where to use the products, how to use the products, and a little bit of ingredient information. But to summarize the range itself, this is a unique range on its own. It has been designed by Nimue as a team, but we've also collaborated with one of the top medical, you could say plastic surgeons in South Africa. So he's worked with us to formulate the range. He's worked with us with the trials to test in his practice himself. So they have been approved, they've been trialed, they've been tested. Some big selling points is that they have what I say no nasties. So there's no petroleum, mineral oil, cortisone, which can often be in a lot of formulations to treat inflammation. And each product has its own selling points. So you can see here, each MD has a USP. So anti-inflammatory serum, great for short and long term. The balm is a protective coat for the skin to aid your skin to heal itself, reducing that downtime. Replenishing rescue is non-greasy, like some eczema creams can be. great with this instant relief. Scar gel, you saw those scars, how it really works on all phototypes, helping with pigmentation. Cooling gel, instant relief from heat and also bruising. Microglide gives you that medium for slip and glide. And you just saw those 2 retail wows. The proof is in the pudding with the before and afters, with the EGF Power Serum and the Expert Brightening Serum. So thank you so much for being attentive this evening. I know it's a lot of information, a lot to go through here.
We have one. Can these products be used with boosters? I think you've answered that, but I'll let you.
Yeah, I mean, you can always use a booster in the morning and keep your serum for the evening. If we're talking of EGF Power Serum, then of course maximum is going to be using and brightening morning and evening. But if you're wanting the serum to last longer, absolutely, just keep it for the evening and use a different booster in the morning. That's the option.
Can you combine Sky Gel with Brightening Serum?
Yes, you can. So Scar Gel you can use initially, post scarring. As soon as you see that scarring starting to heal, you can then use your brightening serum, or you could use one morning, one evening.
Is it safe for breastfeeding mums?
Yes.
I guess that if they're doing scars on their breast, you wouldn't want to put anything on the breast when they're if you're
Still
breastfeeding.
feeding.
Yes.
Yeah.
And for post STS operation.
STS?
The C for cat, S for Sam, CS. I'm not quite sure.
I don't know what operation that is.
Caesarean scar, sorry.
Ah, yes, yeah. So I'll tell you an interesting story if you don't mind. I launched this in the Netherlands and I had a lady who had a tummy tuck. So almost like as if you were, to have, your C-section kind of scarring. She stood up in front of everybody to show her before and afters. So she literally pulled up her top and showed the amazing results of the Scar Gel. So good. So if you can get that Scar Gel on as quick as you possibly can. So once you know that scarring is knitted back together, so there is no open skin, there is no oozing, the scar is not infective, get the Scar Gel on and you will see the results. Honestly, the reduction in scarring and the aiding of healing and skin tissue is fantastic. So yeah, definitely.
All right. Well, thank you very much, Vicky. That was an incredible presentation. I think that we're all going to be walking away with a much deeper appreciation of just how powerful this new MD range truly is. Mm-hmm. It is truly amazing. I'm absolutely blown away by those results and I urge everyone that will start using it to start taking before and after photos, because clients tend to forget how their skin was. If results are within sort of 5 to 8 weeks, you kind of don't realize. But so yes, do please take photos before and then help them see the results, how amazing they are.
Thank you, everyone. Have a good evening.